Welcome to the NCLEX Practice Test for Management of Care. This practice test consists of 40 questions that cover a variety of topics related to management of care, including delegation and supervision, leadership, resource management, and ethical and legal issues. Each question comes with a correct answer and detailed explanation to help you better understand the materials. If you found this video helpful, be sure to like the video and subscribe to our channel for more resources. Let's get started. 1. Nursing care plans are A. Written by CNAs before they provide care. B. Guidelines of care that all nursing team members use. C. Used by nurses but not by nursing assistants. D. Used by nursing assistants but not by nurses. Correct answer: B. Guidelines of care that all nursing team members use. Nursing care plans are documents that are developed by RNs but shared with all members of the nursing care team. The purpose of these nursing care plans is to ensure that all patients have quality care in a consistent manner. 2. Nursing care plans contain which of the following? A. Nursing diagnoses. B. Medical diagnoses. C. MD orders. D. Intake and output forms. Correct answer: A. Nursing diagnoses. Nursing care plans are legal documents that contain nursing diagnoses, such as an alteration of respiratory function. They also contain patient goals and nursing interventions. 3. One major difference between long-term care and respite centers is the fact that long-term care facilities A. Provide only physical care and respite centers give both physical and emotional care. B. Provide care for residents on a long-term basis and respite centers offer only outpatient services. C. Provide care for residents on a long-term basis and respite centers offer only temporary services. D. There is no difference. Long-term care and respite care are the same. Correct answer: C. Provide care for residents on a long-term basis and respite centers offer only temporary service. The major difference between long-term care and respite centers is the fact that long-term care facilities provide both physical and emotional care on an ongoing, long-term basis. On the other hand, respite care centers provide these same services but on a short-term, or temporary, basis so family members can have time off from their daily caregiver role. 4. Penny Thornton has had a stroke, or CVA. She is having difficulty eating on her own. Soon, she will be getting some assistive devices for eating meals. Which healthcare worker will be getting Penny these assistive devices? A. A physical therapist. B. A speech therapist. C. A social worker. D. An occupational therapist. Correct answer: D. An occupational therapist. Occupational therapists assess the needs of residents and patients in terms of their need for assistive devices that can help them with the activities of daily living. Some of these assistive devices include weighted plates and special forks or spoons to assist the person to eat on their own. These devices enable the person to be as independent as possible. 5. A patient will be discharged from the hospital today. Which person will most likely arrange the discharge of this patient to his or her own home, to a nursing home, or assisted living facility? A. A physical therapist. B. A speech therapist. C. A social worker. D. An occupational therapist. Correct answer: C. A social worker. Social workers collaboratively work with other healthcare professionals, such as nurses and doctors, to discharge patients from the hospital to the best type of facility that meets their needs. They help the team to ensure the continuum of care after discharge. 6. Who is the center of care? A. The nurse. B. The doctor. C. The administrator. D. The patient. Correct answer: D. The patient. The patient is the center of care and the center of the team. The patient is the most important member of the team. Healthcare workers must all work together, as a team, to best meet the needs of the patient. The healthcare team works every day and every minute towards the goal of good healthcare. The patient is the main decision maker, the patient is the main focus of the team. They have a right to good care by all of the members of the healthcare team. 7. A staff nurse working on a medical surgical unit witnesses another nurse reviewing a patient's EMR that she is not assigned. What should the staff nurse do next? A. Question the nurse why she is reviewing that patient's chart. B. Notify the charge nurse. C. Notify the unit director. D. Call the Human Resource Anonymous hotline. Correct answer: A. Question the nurse why she is reviewing that patient's chart. The nurse who witnessed the potential violation of EMR should first question the nurse, as this is the appropriate step according to the chain of command. The charge nurse and/or unit director would be notified if EMR misuse was validated. 8. You are working as a valued member of the team in your nursing care unit. You are trying to figure out whether or not the team is doing well. Which of the following is a sign that your team is doing well? A. Conflict occurs, but this is seen as an opportunity for team growth and development. B. No negative feelings are ever expressed, so everyone is happy and satisfied. C. Mistakes are not tolerated. Mistakes result in disciplinary action. D. People are not taking risks and they are sticking to the status quo. Correct answer: Conflict occurs, but this is seen as an opportunity for team growth and development. Some of the signs that a team is successful include the existence of conflict and the belief that this conflict can be resolved, and it can also lead to team growth and development. Other signs of a successful team include accepting mistakes as learning opportunities and the ability to express negative feelings when these feelings arise. 9. The primary purpose of a patient care meeting or conference is to determine which of the following. A. The patient's ability to pay for the costs of their care. B. How the healthcare team can best meet the patient's needs. C. The patient's physical status and condition. D. The patient's psychosocial status and condition. Correct answer: B. How the healthcare team can best meet the patient's needs. The primary purpose of a patient care meeting or conference is to determine how the members of the entire healthcare team can best meet the unique, individual needs of the patient. The patient and family members should be included at this conference or meeting. The patient is the center of care. 10. Who should be members of a patient care conference? A. Doctors, nurses and nursing assistants, since they are healthcare providers. B. Doctors, nurses and the patient and/or the family members. C. All members of the healthcare team. D. All members of the healthcare team and the patient/resident. Correct answer: D. All members of the healthcare team and the patient/resident. The patient or resident is the center of care. The patient or resident and/or their family members, along with all other members of the healthcare team, should be included in a patient care conference. Family members may, or may not, be included in accordance with the patient's or resident's wishes. 11. An 18-year-old female is admitted to the emergency room complaining of abdominal pain, nausea, and vomiting. Lab results indicated an elevation in alkaline phosphatase, bilirubin, and a positive HCG. The patient's parents are at the bedside. Which of the following actions, if taken by a nurse, would signify that the nurse is acting as a patient advocate? A. Directly discussing the results with the patient and family. B. Asking the family to leave the room so the nurse may speak to the patient alone. C. Assuming the patient knows she is pregnant and begins discussing treatment options. D. Administer morphine 2 mg for push stat for patient's 10/10 pain. Correct answer: B. Asking the family to leave the room so the nurse may speak to the patient alone. The nurse has the responsibility to support and uphold the patient's health, wellness, safety, and rights. The patient must protect the patient's privacy, assuming the patient is unaware that she is pregnant. The patient has the right to the opportunity to receive results in private. 12. Who is legally able to make decisions for the patient or resident during a patient care conference when the patient is not mentally able to make decisions on their own? A. The patient or their healthcare proxy. B. Only the patient. C. Only the healthcare proxy. D. The doctor. Correct answer: C. Only the healthcare proxy. When a person is not able to mentally make decisions, it is the healthcare proxy that legally makes decisions on their behalf. Incompetent patients cannot legally make decisions. Additionally, it is not the doctor, but only the patient or healthcare proxy that makes decisions. Doctors can make suggestions and recommendations, but not decisions. 13. Patients have a right to underscore A. Only enough information so they can comply with care. B. All of their health-related information. C. Small amounts of information so they do not get nervous. D. Moderate amounts of information unless they are old. Correct answer: B. All of their health-related information. Patients have a legal right to all of their health-related information. Nurses must legally, ethically, and morally uphold this patient's right. 14. You are working the 8 a.m. to 4 p.m. shift. You begin to vomit at 3 p.m. and you do not think that you are able to continue working. You decide to immediately go home without notifying your RN supervisor. You have underscore A. Enough sick time so this is not a problem. B. Finished all your work so this is not a problem. C. Seriously abandoned the patients. D. Seriously abused and neglected the patients. Correct answer: C. Seriously abandoned the patients. Patient abandonment is very serious and it can be grounds for disciplinary action and immediate termination of employment. It is defined as leaving the patients without getting the consent of the supervisor. 15. A patient is being discharged from an acute care rehabilitation facility to home following a CVA with left-sided hemiparesis and dysphagia. Which of the following disciplines would the case manager include in the patient's discharge planning meeting? A. Speech therapy. B. Physical therapy. C. Occupational therapy. D. All of the above. Correct answer: D. All of the above. Speech, physical, and occupational therapy would all be required to facilitate a safe discharge home for this patient. Speech therapy would be required for the management of dysphagia. Occupational therapy would be required to assist with a patient's ADLs. Physical therapy would be required for assistance/adaptation in mobility due to the hemiparesis. 16. You are taking care of 5 patients today. One of your patients wants water, another needs help walking to the bathroom, another just stated that they have chest pain, and another is crying because his daughter did not visit him today. Which patient care problem must you deal with first? A. The water. B. Help to the bathroom. C. The chest pain. D. The crying person. Correct answer: C. The chest pain. The chest pain must be addressed immediately, before the other issues are dealt with. Chest pain is a very serious physical problem that could indicate that the patient is having a heart attack. 17. You are taking care of 7 patients today. One of your residents wants water, another needs help walking to the bathroom, another just stated that they have chest pain, and another is crying because his daughter did not visit him today. Which patient care is the lowest in terms of priority? A. The water. B. Help to the bathroom. C. The chest pain. D. The crying person. Correct answer: D. The crying person. The crying person is the lowest priority. All of the other needs are physical needs that take priority over emotional needs. This does not mean that you should not address the crying. You must address it, but it is the lowest priority at this time. 18. The nurse is gathering necessary materials to change the patient's abdominal dressing at the end of her shift. The nurse is concerned she will not have time to document the dressing change thoroughly and accurately. When should the nurse document the care? If, before doing the dressing. B, during the procedure to apply the dressing. C, after the dressing has been changed. D, all of the above. Correct answer, C, after the dressing has been changed. Documentation should never be pre-charted. All required components of documentation should be completed after the dressing has been changed. 19. You are caring for Mrs. Thomas. You see a notation on the nursing care plan that states ambulate at least 10 yards QID. This patient will be assisted with ambulation at which of the following times? A. 10 a.m. B. 10 a.m. and 2 p.m. C. 10 a.m., 2 p.m. and 6 p.m. D. 10 a.m., 2 p.m., 6 p.m. and 10 p.m. Correct answer, D. 10 a.m., 2 p.m., 6 p.m. and 10 p.m. QID is the acceptable abbreviation for 4 times per day. These times, in most facilities, are 10 a.m., 2 p.m., 6 p.m. and 10 p.m. 20. The supervising RN asks you to bring the unit's collected lab specimens to the lab stat. You should underscore. A. Do not do this errand because nurses do not do stats. B. Run this errand as soon as you can. C. Run this errand immediately and without delay. D. Before the end of your shift or after your lunch. Correct answer, C. Run this errand immediately and without delay. STAT is the acceptable abbreviation for immediately and without any delay. Doing errands, like bringing lab specimens to the lab, can be done by nurses. 21. You are working the 4 p.m. to 12 midnight evening shift. You are taking care of a group of patients. The supervising RN identifies 5 patients who get medication at HS. When will you give this medication? A. After the dinner meal. B. Whenever requested. C. At the patient's bedtime. D. Before the end of the shift. Correct answer, C. At the patient's bedtime. HS is the acceptable abbreviation for at the hours of sleep or at bedtime. 22. You are caring for Mr. Charles Y. You see a notation on the nursing care plan that states, remind the patient to use the incentive spirometer TID. This patient will be reminded at which of the following times? A. 10 a.m. B. 10 a.m. and 2 p.m. C. 10 a.m., 2 p.m. and 6 p.m. D. 10 a.m., 2 p.m., 6 p.m. and 10 p.m. Correct answer, C. 10 a.m., 2 p.m. and 6 p.m. TID is the abbreviation for 3 times a day. These times are usually 10 a.m., 2 p.m. and 6 p.m. 23. A nursing care plan states, assist the patient to the bedside commode PRN. When will this patient get this assistance to the commode? If, whenever needed. B. At bedtime. C. During the night. D. During the day. Correct answer, whenever needed. PRN is the acceptable abbreviation for whenever needed or whenever necessary. 24. You see a sign over Mary Jones' bed when you arrive at 7 a.m. to begin your day shift. The sign says, NPO. Miss Jones is on a regular diet. The patient asks for milk and some crackers. You underscore. A. Can give her the milk but not the crackers. B. Can give her both the milk and the crackers. C. Can give her the crackers but not the milk. D. Cannot give her anything to eat or drink. Correct answer, D. Cannot give her anything to eat or drink. NPO is the acceptable abbreviation for nothing by mouth. Mary Jones can have nothing to eat or drink. 25. A case manager is planning a discharge for a patient after being admitted to the hospital for an exacerbation of COPD. What information would be a priority in identifying the home care needs for the patient? A. Blood pressure. B. Ability to perform ADLs. C. Transportation to physician visits. D. Obtain pulse ox when ambulating. Correct answer, D. Obtain pulse ox when ambulating. All of the above information would need to be included in the discharge planning for this patient. However, the priority for this patient is oxygenation. The case manager must determine if oxygen will be required at home for the patient. Maslow's hierarchy of needs could be used in prioritizing patient needs. 26. Match the abbreviation with the correct definition. A. BID, at bedtime. B. TID, tomorrow. C. AC, before meals. D. PC, patient care. Correct answer, C. AC, before meals. The abbreviation AC means before meals. BID is twice a day, TID is 3 times a day, and PC is after meals. 27. Which is not an acceptable abbreviation? A. D/C. B. TID. C. BID. D. QID. Correct answer, D/C. D/C is not an acceptable abbreviation. It can be confused with both discharge and discontinue. 28. You are taking Mr. D's blood pressure. The first sound that you hear is at 162 and the second sound that you hear is at 86. You should document and report that the blood pressure is underscore A. 86/162. B. Irregular and high. C. 162/86. D. Normal for people of all ages. Correct answer, C. 162/86. You should document and report the blood pressure measurement for Mr. D is 162/86. The first sound that is heard is the systolic reading, or the top number, and the second sound that is heard is the diastolic reading, or the bottom number. Blood pressures are not observed as irregular, pulses can be irregular. This blood pressure is not normal for people of all ages. It is high. 29. Your elderly patient has a temperature of 98.5 degrees. Is there anything else that a nurse should do, in addition to documenting this temperature? A. No, this temperature is within normal limits. B. No, this temperature is normally hyperthermic. C. Yes, this temperature is highly hyperthermic. D. Yes, this temperature is highly hypothermic. Correct answer, no, this temperature is within normal limits. No, there is nothing else that a nurse should do. This temperature, for an elderly patient, is within normal limits. 30. The abbreviation AC is defined as underscore A. Before the meal. B. With the meal. C. After the meal. D. Anticorpus. Correct answer, before the meal. The abbreviation AC is defined as before the meal. 31. The abbreviation PC is defined as underscore A. Before the meal. B. With the meal. C. After the meal. D. Post-corpi. Correct answer, C. After the meal. The abbreviation PC is defined as after the meal. 32. At the beginning of the shift, a nurse receives a report for her daily assignment. Which of the following situations should the nurse give first priority? A. A diabetic client with a blood glucose level of 195 mg per deciliter. B. A family member of an elderly client who has questions. C. A client with COPD with an oxygen saturation of 84%. D. A client who requires assistance to use the bathroom. Correct answer, C. A client with COPD with an oxygen saturation of 84%. When prioritizing the needs of clients, the nurse must begin with the unstable client or manage conditions that affect airway, breathing, or circulation first. The client with COPD has a condition that affects breathing and is exhibiting decreased oxygen saturation levels. therefore, this client should be the first priority. 33. Mr. W has orders for a physical therapy consultation. The nurse contacts the appropriate department, but 12 hours later, no one has come to see the client. Which is the most appropriate action of the nurse? A. Call the supervisor and file a complaint against the physical therapy department. B. Contact the physician to notify him that the orders were not carried out. C. Assess the client's activity level by assisting with ambulation using a gait belt. D. Contact the physical therapy department again and repeat the order. Correct answer: D. Contact the physical therapy department again and repeat the order. Nurses must typically work as part of a larger interdisciplinary team that involves collaboration with other professionals. In order to fulfill the client's needs, communication between disciplines should remain respectful, with clear directions about each discipline's responsibilities. Communication between all parties minimizes confusion about the client's care. 34. The B in the SPR acronym stands for A. Background, B. Basic, C. Beginning, D. Break. Correct answer: background. The B in the SPR acronym stands for background. The SBAR is a communication tool used between providers that regulates the type and amount of information given. When contacting a physician, the nurse provides information about the situation, the client's background, the nurse's assessment, and further recommendations. 35. A case manager is planning a discharge for a patient who will be placed on long-term antibiotics secondary to a left hip replacement that has become septic. To facilitate a safe discharge, prioritize the following 4 at-risk problems for the discharge plan. Infection, self-care deficit, impaired skin integrity, fluid volume deficit. A. 1, 3, 4, 2. B. 3, 1, 4, 2. C. 1, 4, 3, 2. D. 3, 1, 2, 4. Correct answer: C. 1, 4, 3, 2. The priority for the case manager is preventing readmission secondary to infection. The next priority for this patient is prevention of fluid volume deficit related to complications of long-term antibiotic use. Impaired skin integrity would be the third priority due to the left hip incision followed by self-care deficit. 36. Decide which of the following tasks may be delegated to unlicensed assistive personnel. A. Cleansing a wound with peroxide. B. Irrigating a colostomy. C. Assisting with performing incentive spirometry. D. Removing a saline lock 4. Correct answer: C. Assisting with performing incentive spirometry. The nurse may delegate certain tasks to unlicensed assistive personnel as part of working together and reducing heavy workloads. Assistive personnel may perform tasks that involve activities of daily living, non-invasive skin care, or assessment of vital signs, including assisting the client with incentive spirometry. Despite appropriate delegation, the nurse is ultimately responsible for the actions of the unlicensed assistive personnel. 37. According to HIPAA, which of the following is considered an individual right for privacy of a client's protected health information? A. The right to receive medical bills for care received. B. A copy of the organization's privacy practices. C. The right to change personal health information. D. An understanding that protected health information will only be used in regards to client treatments. Correct answer: B. A copy of the organization's privacy practices. According to HIPAA, individuals receiving care at healthcare facilities have rights surrounding their protected health information. This information may be used for treatments or billing purposes, and clients may receive copies of how the information was used. All organizations must provide clients with copies of current privacy practices. 38. Which of the following clients is most likely ready to be dismissed from an inpatient care setting to home? A 65-year-old male with urine output of 60 cubic centimeters in the past 4 hours. B. A 2-month-old female with a temperature of 100.6 rectally. C. A 38-year-old female who transitioned from 4-TPN to full liquids 6 hours ago. D. A 4-year-old male with an oxygen saturation of 96% on room air. Correct answer: D. A 4-year-old male with an oxygen saturation of 96% on room air. Clients must meet a certain amount of set criteria before they will be discharged from a healthcare facility. Although guidelines may vary between locations, most healthcare facilities expect clients to have adequate oxygenation, nutrition, and elimination, and be free from fever, vomiting, and significant pain. 39. The nurse is performing discharge teaching for Mrs. S after cardiac angioplasty. Her husband is present for the teaching. While explaining the prescription for antiplatelet medication to use at home, Mrs. S's husband states, "I don't think I can afford to refill that medication." What is the most appropriate response of the nurse? A. Don't worry, your insurance will cover it. B. I'll ask the physician if he can prescribe a medication that is more affordable. C. You should apply for Medicare to see if they can help you. D. This medication is essential for her care and should be given priority over all others that she is taking. Correct answer: B. I'll ask the physician if he can prescribe a medication that is more affordable. In some situations, clients are sent home with prescriptions for important medications that they cannot afford. If a client mentions this to the nurse before discharge, she may be able to ask the provider for a prescription that has the same action but is more affordable to the client, such as through generic formulations or a different manufacturer. 40. The discharge planning team is discussing plans for the dismissal of a 16-year-old admitted for complications associated with asthma. The client's mother has not participated in any of the discharge planning process, but has stated that she wants to be involved. Which of the following reasons might prohibit this mother from participating in discharge planning? A. The client is an emancipated minor. B. The mother has to work and is unavailable. C. The client has a job and a driver's license. D. The mother does not speak English. Correct answer: the client is an emancipated minor. Clients who are under the age of 18 usually need parent involvement in their care and planning after they will be dismissed from a facility. There are times when it is inappropriate or impossible for a parent to be present during the discharge planning process. If a client is under age 18 but is an emancipated minor, he may specify that he does not want his parents present at discharge planning meetings. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channels for more resources.